Bonjour, je suis enchantée d'être ici avec vous. Merci bien d'avoir m'invité. My name is Danika Tynes, and I want to thank you for welcoming me here to this special gala focused on technology and health. I would like to especially extend my sincerest appreciation and thanks to Mrs. Greta Roy-Clement, Minister of Public Health and Population, and to the organizers who have pulled all of this together. I'm very pleased to speak with you today about digital health. With the COVID-19 pandemic, many more of us have become aware that borders are not enough to separate us, and that our collective well-being relies on our coming together to innovate in our response to global challenges. We have further become acutely aware of how technology can help with our responsiveness to population health needs and increase our access to data to inform our policies and interventions globally. While digital health is not new, the need for realization of its full capabilities has accelerated exponentially with the pandemic because it has laid to bear any fragilities in our healthcare systems and our abilities to provide ready access to healthcare. In its literal sense, what we mean by digital health is how we apply technology to support the delivery of healthcare across populations. Applications such as electronic health records, telehealth, blockchain, artificial intelligence, privacy and security of health data, and the like have all been beneficial adjuncts to traditional healthcare delivery methods. Yet what we have seen during the COVID-19 pandemic is this need to leverage these types of technologies so we may better prepare, better predict, better decide, and better serve. From my experiences, both as a practitioner and a researcher, I would just add to that definition that digital health is also about access. At Georgia Tech Research Institute, my home institution in Atlanta, Georgia, in the United States, we worked quickly in response to the pandemic to establish a data lake to serve as a repository for public health data for the state. This solution provided access to the data that could then be readily mined and manipulated to better inform decision-making and interventions. In a telehealth implementation in one of the US's more rural states, Mississippi, one of the first patients after standing up the system, a woman who lived an hour and a half from the urban center where specialty care primarily occurred, was able to present for a telehealth visit in her hometown. She had missed her last 5 diabetes specialist appointments because she worked 2 jobs and had unreliable transportation. With telehealth, that patient was able to present for her specialty appointment at her local clinic during her lunch hour, with the added benefit that her nurse, known and trusted by her, was also able to hear the camp plan and reinforce it at the community level. This offered geographical access gap closure. In implementing a proactive care model for a large health plan, a predictive modeling tool was interfaced with the existing electronic health record system to flag patients at the point of care based upon certain criteria for cancer screenings. Shortly after implementation, a patient presented for care who had hurt his knee on the job. Based on his history and demographics as calculated by the tool, the nurse was alerted he should receive a colon cancer screening. He underwent the screening and he had cancer. They caught it early and he was in remission in a short period of time. This created access to better clinical outcomes. In a systems implementation for a consumer-directed care program, payroll was facilitated by a new system that tracked provider hours for home visits, supporting financial reimbursement of community-based providers in support of patient ability to be cared for at home. This provided access to increased quality of life for patients and access to reduced healthcare system burdening. Digital health applications such as these and others like remote monitoring, augmented reality, virtual clinical trials, or mobile health have proven effective in providing better health outcomes and for health system strengthening, which are much needed when globally we are facing a rise in communicable and non-communicable disease. So again, access, in my mind, is our why of digital health. To be clear, access considers inclusion and it considers equity. Because the pandemic, due to its infectious nature, has increased this need for digital solutions such as remote monitoring or machine learning, natural language processing, or predictive modeling. What we also must keep at the forefront is not to let this urgency take us backwards. There exists a digital divide globally, and we can see that by demanding our populations take part in our very smart solutions, like online learning or telehealth, we are also increasing the gap between those who have access to technology and those who do not, creating a digital inequality. Data shows that nearly half of the world's population does not have adequate access to the internet. Fewer than 1 in 5 people in the least developed countries are connected, impacting women more than men, often the cost of data being prohibitive, or the infrastructure is altogether unavailable. We should therefore be very aware while we are innovating that we are not creating a situation where we're leaving more people behind than ever before. Because where technology used to help research and intervene on social determinants of health, it has now effectively become a social determinant of health itself. Meaning if you don't have internet, likely you will be left behind in health, in education, and in participation in society. When we select a technology to augment traditional healthcare services, it is also important that we are not selecting technology for technology's sake or for the latest trend. Each nation state has finite resources, and no nation state can afford to replicate comprehensive healthcare services in all urban and rural areas. Digital tools can serve as an adjunct to help close gaps in healthcare with one caveat. The need and the ability must take the lead, and the technology can follow. The need and the ability, what does that mean? So I conducted a global study on the conditions for successful telehealth adoption, and unsurprisingly, among my findings was that one of the strongest predictors of sustainable telehealth adoption was the need for a certain level of maturity of an information communications technology or ICT infrastructure. Put more simply, for telehealth to work, first must come reliable infrastructure such as broadband and cell phone towers. Without that ability, these programs are more likely to stay in pilot stage or not become part of the healthcare system, but offer suboptimal results that may strain resources and not fully realize its intention. So if there's a need like closing geographical access barriers, but there's no ability to deliver on the promise of the solution, then we should rethink our approach. Key is governance. Key is strategic planning rather than reactionary approaches. Key is proper funding and workforce literacy. Key is considering that which will enable a successful digital health approach. Nation states have massive populations to care for, doing their best to care for the most people most of the time. Policy and institutional changes often move far less rapidly than the pace of technology itself. So for our governments to keep pace while being thoughtful about their policies is often prohibitive. Therein lies the immense opportunity for more public-private partnerships. Private innovation companies have the luxury to fail fast, as they say. Private companies can take larger risks because the fate of a nation is not at stake. And this is the perfect place to incubate ideas to help meet the needs of nation states. Nations will benefit greatly from having dedicated partnership strategies that work to support offering sound, innovative solutions while maintaining fiscal responsibility over how finite funds are used. Private organizations can usher in these ideas once incubated and offer a less risky proposition for innovating across a healthcare system in close collaboration with public institutions. I would like to summarize with 3 thoughts. First, let the why lead the strategy for digital health and be realistic about the ability to successfully adopt new technology. Consider, for example, if the why or the need is to provide more remote healthcare services. Is the infrastructure in place? Are there enough trained resources? Of those who may benefit from a remote patient visit, who are we leaving out? What is the plan to close the access gaps for those who have no access to broadband? Is the workforce trained to adapt to new clinical workflows? What is the governance structure? Do these capabilities offer scalability, perhaps through interoperability? And is gathering data enabled to better inform interventions? Based on these and other considerations, the right solution can be adopted to advance the strength of healthcare systems. Second, enable the sustainability of innovation long-term and not as a quick fix. Digital health offers so many promises, all realizable. A full health system overhaul overnight is not the goal. Instead, let us launch efforts that enable institutional shifts such as assessing curricula in school, looking forward to the strengths that will be needed by the workforce, assessing broadband access and closing the gaps therein, or assessing institutional capacity to govern new digital health programs and policies. We can get ready to be ready, and then we can enable our digital tools to fully realize their promise. Lastly, create a dedicated focus on partnerships. Public-private partnerships have become a successful formula for responsiveness to the increasing burdens on our global healthcare systems. For example, pharmaceutical companies have answered the call for developing vaccines and antibodies for COVID-19. They have the capacity, they have the talent, they have the financial incentive, they have the infrastructure for research and development. Or companies like Google and Microsoft have started offering free training programs in project management, data analytics, and software development to help with advancing workforce literacy in areas we foresee will need more professional talent. New startups such as Brave have begun offering mental health support for issues created by isolation or the challenges of becoming a remote worker. Creating collaborative partnerships with organizations such as these can be a powerful ally towards health system strengthening, alleviating the burden on nation-state resources. I'll close with this. With intentional, inclusive action, we are truly at the precipice of realizing a new type of healthcare that provides greater access to our populations. Thank you again for giving me the opportunity to share this perspective on digital health. I look forward to how Haiti translates digital health into a strategy that elevates the well-being of our Haitian family. Merci bien.